Perfect. Well, thank you. Good morning. Thanks for being here. Welcome to this month's or this summer's Direct Care Workforce Collaborative. We have a full agenda today. We're super excited about the information we're able to bring you. So we're going to jump right in. So just a quick overview of today's agenda. We're going to start with the typical welcome, attendance, some housekeeping and polls. Then we're going to pass it over to Rachel with HICPUF to give us an overview of the NCI State of the Workforce Survey. Then we're going to have Carly from Consumer Direct Colorado give us a little bit of information about their information and assistance program. Tiffany from HICPUF is going to give us just a general overview of that federal Medicaid access rule. And then we're going to have an open forum and then go ahead and close this out. So should be a great meeting. Really looking forward to it. So just some quick housekeeping. We are recording, so that's just a reminder to avoid sharing any protected health information as you engage in conversation and also in the chat. We do post these recordings to our website, and if we have PHI in it, we're not able to do that. So just a quick reminder just to be mindful of what we're sharing. Feel free to use the chat. We have folks here from my team that are helping me monitor the chat. You can engage with our speakers that way, ask questions, drop resources. We encourage you to do that. The slides will be posted to the Direct Care Workforce Collaborative website with the recording, usually about 5 to 7 days. We have to do some accessibility checks and get things cleaned up, and then we get it posted for folks. And that will include all of the presenter slides as well. If you're listening by phone, welcome. We have *6 to unmute your line or *9 to raise your hand to engage with our speakers or ask questions. I have turned on closed captioning, and so you are able to navigate that on your own screen on your black Zoom toolbar. You can turn that on or off as you need. And then meeting information for this meeting and also information about other direct care workforce projects are actually on our new direct care workforce page. So you can get to the collaborative page, but then also keep track of what also is happening in this space with our team. So I'm going to drop just a handful of links in there for you to access. There's the collaborative website, our new homepage for the direct care workforce, our email address, and then we also have an email newsletter. That's for OCL, and that is just to keep track of all the things happening in OCL and not just our team specifically. So if you're not signed up with that, we'd encourage you to do that. While we wait for more folks to join before we get into the polls, I'd love to just do a quick roll call in the chat and attendance. So if you wouldn't mind dropping your name, your location, and your title into the chat. If you're a phone-only user, I'm not sure we have anybody, but let me double check here. We do have a couple. So if you're a phone-only user and you'd like to call out and log in, I guess, go ahead and press *6 to unmute your line or *9, and we can make sure that you are captured in the attendance. But we'll let folks get to that as we move forward here. I'll just let you kind of do that in the background. If this is your first meeting, we like to do just a little level set, a little welcome. The Direct Care Workforce Collaborative is committed to advancing the awareness of the workforce and advocating for improved benefits, compensation, training, career advancement, all good things for the workforce. Really envisions a strong, skilled, and respected workforce, delivering high quality care, really working on recruitment and retention of this workforce and making sure that they feel valued and seen in the work that they're doing, and just finding ways to support and connect around that. So this is a quarterly collaborative, this meeting here, and that's really about information dissemination. We usually have a lot of presentations, a lot of information that we're sharing with you, but if you want to get a little bit closer to the action, we do have action groups, and that's training and career advancement, compensation and benefits, and value and awareness. And the collaborative itself and the action group stakeholder voice is really important, really paramount in these groups. We value that. We value your feedback, and we want to use that to keep us moving forward. And so for that reason, we actually have stakeholder co-chairs that man those groups. We're not doing introductions or anything today, just because I'm not sure how many of them were able to join us. But if you want to get to know them and also get a little closer to the action, you can join our action groups, which I'll have a little information on here in just a second. But this just gives you an idea of who our stakeholder co-chairs are, the great experience they have, the different avenues that they're coming from. Really happy to have these folks kind of stepping up and lead those efforts in those bi-monthly action group meetings. Again, they do a little bit more closer to the action, get a little bit closer to the topics that you might be interested in. For example, Training and Career Advancement has been providing feedback to HICPUF on the Direct Care Workforce Mentoring Framework that we worked on through a technical assistance opportunity. We've been getting some career pathway updates, and they've been able to provide feedback on that process, as well as those one-pagers that we're hoping to come out with. So just really able to provide feedback and really give direction and vision to the the projects that are happening, both in HICPUF and also outside of HICPUF as well. We like to have presenters and information come in. Compensation and benefits is really about connecting folks with resources that are already available. And so we had a Colorado Secure Savings presentation in May. We also had a Get Ahead Colorado presentation for, tax help earlier in the year. And so that's just really about putting tools in your toolkit and making sure you're aware of what's available to both employers and providers and also workers across the state. And then value and awareness is all about bringing forward the value that this workforce brings. And so they worked really hard on a Direct Care Worker Appreciation Week in April. And so we had some social media posts and some things happening, and some individuals and some agencies really did a lot of celebrating around that. And so really excited to have that. That's something that happens every year now. So the action groups are taking the summer off. We're giving them just a little bit of a break. Plus, summer's a really tough time to get things going. So they're reconvening in September. But if you'd like to get involved, we actually have a sign up for the action group here. It's just a quick little survey. You can say which one you want to get involved in, or all three. If you sign up, it doesn't mean you necessarily have to come to every meeting, but it does mean that you are on the agenda list and also the note list, so you can kind of keep a pulse on what's happening in those groups and get involved as your schedule allows. We are going to go ahead and launch some polls. We've kind of leveled off here in our participant list, so I'm going to go ahead and launch a couple polls for us. This just gives us an idea of who's joining us. So the first one is what region do you represent, or where are you joining us from today? I'll give just about a minute for this. Just another few seconds here. That seems to have leveled off. So let me go ahead and end the poll and share the results. So well represented in our regions 1 and 3. We do have a few folks joining us from region 2, which is great. Technically, we do have somebody from the Western Slope because I'm in Montrose. So if I could vote, I would put in for 4. And then we are, of course, a little underrepresented in our Southwest region. That's kind of typical. We have done a little bit of outreach down there and trying to connect with folks down there. But this is pretty typical of what we see both in our collaborative and in our action group. So just continuing to work with the leadership team and do a little bit of outreach just to see if we can get folks represented from all over. So thanks for participating in that. And then the second one is just how you identify in the continuum. What connects you to the work that we're talking about today? Give that about 20 more seconds. All right, that has leveled off for us. So let me go ahead and end the poll and share the results here. So we have a few folks that actually received the services. We have lots of employers, advocates, lots of government agencies, of course, a couple trade orgs. And then if you selected other, looks like just maybe 1 or 2 of you. If you'd like, you can drop that in the chat, just how you're connected to the work, just so we can get an idea of other ways or other populations we might be able to capture. So thank you for that. All right, let's keep on moving here. So I'm going to hand this over to Rachel here at the department to do a quick introduction and then to hop right into her presentation. So Rachel, if you are with us.
Hey everybody, my name is Rachel Newton. I am a quality policy specialist here at HICPUF, and I'm here today to talk to you about the state of the workforce survey. Next slide, please. Each year, National Core Indicators of Intellectual and Developmental Disabilities, also known as NCI-IDD, implements the State of the Workforce Survey. The Department of Healthcare Policy and Financing is mandated by the state legislature, House Bill 18-1407, to participate. The survey collects comprehensive data on provider agencies and the direct care worker or DCW workforce, providing direct supports to adults age 18 and over with intellectual and developmental disabilities, or the DCW workforce providing direct supports to aging or physically disabled adults. The goal of this survey is to help states describe their workforce, measure challenges, monitor improvements. HCPF has been participating in the State of the Workforce IDD since 2018 and participated in the State of the Workforce AD pilot in 2021 and began participating in the survey in 2022. The data that's going to be presented in this presentation represents the Colorado survey results released for the 2023 State of the Workforce survey data. Each survey year reflects a calendar year period, so it's asking agencies to respond between January 1st and December 31st of that surveyed year. I'll also do some cross-year analysis and compare 2023 results with 2021 and 2022. However, during the presentation, you'll see 80 is missing results from 2021, and this is because that was the piloting year for the survey, and no data report was released due to this just kind of being more of the survey being tested. Next slide, please. Okay, so for the survey, direct care workers were defined to support aging and or disabled adults, which is the AD survey, or adults with intellectual and developmental disabilities, and help them live fulfilling lives, make choices, and live and work in the community. So direct care workers included all peoples whose primary job responsibility was to provide support, help with skills development, guidance, or personal assistance at any location or during any activity. So this could be like at home, at leisure activities, at work, or during recreational activities. It also included all full-time and part-time DCWs, and then all paid staff members who spend at least 50% of their time providing those direct service supports. They could do supervisory tasks, but their primary job responsibility had to be to provide direct support work. Next slide, please. Okay, so who is eligible for the IDD survey sample? That included agencies that provide services to members enrolled on the developmental disability and the supported living services waivers. And then the AD survey sample included agencies who provide services to the elderly, blind, and disabled, community mental health supports, complementary and integrative health, and the brain injury waivers. Next slide, please. Who wasn't included? So clinically licensed staff, behavioral specialists, technicians, and clinicians, agencies that provided only transportation, home modifications, and or meal delivery, contract or 1099 workers, on call or as needed, temporary staff, again, that admin or supervisory staff, unless they spent, 50% or more time doing that direct care, nursing home facilities, and direct care workers that provided self-directed supports. Next slide, please. Okay, so the sample is pulled biannually from our billing records. If the agency provided services that fit within that criteria that's set by NCI or National Core Indicators for the members that were enrolled on those specified waivers, and the service was billed within the past 6 months, the agency is sent a survey link to participate in the survey. It's just important to note that while the department is mandated to participate, it is voluntary for agencies to participate. So just keep in mind while we view the data, we aim to stay within a plus or minus 5% margin of error, but we do not always hit the survey target. And just to kind of also keep in mind the higher the margin of error, the less confident we can be that the results are representative of the entire population. So I just wanted to point that out so we can keep that in mind as we view the data. Another thing to keep in mind is, again, agencies only reported information on employees. So this data does not include independent contractors or any of those direct care workers that are providing services through self-directed supports. And this is just because, that member or sometimes independent contractors, can dictate wages and services, so it's not included in the data. Next slide, please. Okay, so agency demographics. From the data, we can tell that, IDD agencies that participated in the survey mostly provided non-residential supports, which were defined as supports provided in a day program, community program, or work setting, with 83.9% providing non-residential supports. 53.8% provided residential supports, and that was defined as supports provided to a person in a home or apartment that is owned or operated by the agency. And 51.6% provided in-home supports, which were defined as supports provided to a person in a home or apartment that is not owned or operated by the agency. When we look across data from reporting years 2021 and 2022, it's not represented on this slide, but this has remained consistent. IDD agencies in Colorado also tend to be smaller than AD agencies, with 76.3% of responding agencies reporting they had only 1 to 20 direct care workers on payroll. And then 8% had 21 to 40. 7.5% had 41 to 60, and 7.5% had 61 or more on their payroll. Next slide, please. Okay, so 80 agencies participating in the survey mostly provided those in-home supports, with 69.4% providing those in-home supports. About 41% provided residential supports, and 20% provided those non-residential supports. Again, the AD agencies tend to be bigger and have more DCWs on staff. So about 52% of the responding agencies had 1 to 20. 15% had 21 to 40, 10% had 41 to 60, and 23% had 61 or more. Next slide, please. Turnover rate. So both AD and IDD agencies have seen a decrease in turnover rates. In 2023, the IDD turnover rate was about 43%, and the AD turnover rate was about 33%. So we can also see from the data that turnover rates for DCW serving the IDD population is a bit higher than the turnover rate for the DCW serving the AD population. Next slide, please. The data for vacancy rates is looking at full-time positions the agency is actively trying to hire. So there was a decrease in vacancy rates for full-time positions overall with both the IDD and AD agencies. IDD agencies reported a 12% vacancy rate in 2023, and AD agencies reported a 7% vacancy rate. We can also see from the data that DCW vacancy rates serving the IDD population are higher than the AD vacancy rates. Next slide, please. In 2023, both IDD and AD agencies reported a decrease in the number of agencies that turned away or stopped accepting new service referrals due to DCW staffing issues. About 44% of IDD agencies reported turning away or stopping those new service referrals, while 39% of AD agencies reported turning away or stopped accepting new referrals. Next slide, please. Tenure looks at the length of time DCWs stay in their job. The state of the workforce examines tenure for those who were still on payroll as of December 31st and those who left employment during the surveyed year. For AD and IDD agencies, tenure for employee DCWs is similar. However, it does appear that DCWs for IDD have been in their job for 3 years or more. So while IDD agencies do have that high over turnover and vacancy rates, DCWs tend to remain in their jobs longer once employed, the DCWs serving the IDD population. Tenure for separated DCWs also appears to be similar. However, more AD employees left the agency within that first year of employment than IDD. Next slide, please. Both agency types also reported an increase in wages. In 2023, the average hourly rate for IDD agencies was $19.01, while the average hourly rate for AD agencies was $17.77. So we have seen an increase there. Next slide, please. So benefits. This slide is representing 2023 data. So in 2023, IDD agencies appeared to offer more benefits to employed DCWs than AD, although AD offered more sick time to their DCW employees. And I won't make you listen to me stumble around the percentages on this slide, but this will be probably available to you afterwards if you want to take a deeper dive. Next slide, please. Recruitment and retention strategies. So this is just kind of showing you the percentage of agencies that support DCWs to acquire credentialing. So for IDD agencies, that was 30% in 2023, and 80 was 70% in 2023. Next slide, please. Yeah, thank you. And then this one is showing the percent of agencies that gave bonuses, stipends, or raises to DCWs at key steps of that credentialing process. So it doesn't look like it has moved too much. In 2023, about 29% of agencies are providing those bonuses or raises. And then AD, about 24% are providing those bonuses or raises. Next slide, please. Yeah. Are there any questions that anybody has about the data or state of the workforce?
You are welcome to come off mute or drop your questions in the chat. I do want to note Corinthia had a good point. The numbers for duration timeframes of 2 or more years might be COVID related too, which I think is just when we're looking at data over the last couple of years, it's important to always note that COVID was around at that point. So that's a great point, Corinthia. Thank you.
Oh yeah, sorry, I missed that point, but definitely a great point. I think I typically also mention something this is probably the first year I haven't mentioned it, but yeah, definitely COVID could be an influence on the data.
Yeah. Any other questions? Rachel, I might have a question. So we are going to provide the slides out to folks. We'll post them on the website. But is this information available in like a report form as well that folks could dig into?
Yeah, if you go to the next slide. On here is my contact information, and then also it's missing an F, an H at HICPUF, HCBS surveys at state.co.us. Actually, I thought that was the website. So what I can do is I'll drop the website link into the chat. But all of these reports and more, we're always doing NCI surveys, quality surveys. There's just a whole ton of information that's available to you. Sometimes we only keep reports up for like a certain time frame, so maybe like 5 years. So if you're ever interested in, seeing more reports, please feel free to reach out to me. We have those archived and are happy to share those with you at any time. So yeah, if you have any interest in all this great data we have, we'd be happy to share.
Perfect. Thank you. It looks like she dropped that in the chat for us. We also
Oh,
collect
I'm
all
sorry.
the,
That is the wrong thing. Hold on. I don't even know.
I just pulled that out. There we go. Perfect. That sounds great. And we do collect all the links too, and send those out. Make sure that all the links are active in the slides and stuff, so you'll have access to everything that's shared after the meeting as well.
Well,
All
thank you so
right.
much for having me today.
Thank you, Rachel. All right. Well, let us go ahead and move on here to our next presenter. I'm going to stop my share and hand it over to Carly to do an introduction and to share a little bit of information.
Thanks, Brooke. I am just pulling it up. Let me know if you cannot see my screen. But my name is Carly Christensen, and I am the INA or Information and Assistance Lead here at Consumer Direct Care Colorado. And I am very excited to introduce our semi-new program here. It launched this past November. And yeah, so we'll go ahead and get started. All right, so INA stands for Information and Assistance. It covers a broad range of topics that are relevant to members and authorized representatives. Each service type is designed to meet specific needs of our members. So our goal is to offer clear, accessible, and valuable information to help our members and their authorized representatives navigate their unique situations effectively. We help assist participants in navigating Medicaid programs, enhancing their management skills to become better managers of their services. Our team partners with members to improve their abilities to manage services and obtain the necessary supports. So these services are very similar to support brokerage programs in other states and are completely optional for CDAS and IHSS members. So members that are interested in enrolling are able to enroll in INA either at the beginning of their CDAS and IHSS journey or whenever they feel it may be best fit. And we'll be kind of going through like the different service types and the enrollment process as well through this brief presentation. So, like I said, INA is open to incoming or current CDAS members or IHSS members and authorized representatives. So, it's really built for anyone that's needing extra guidance and support navigating their services. I really like to say it's like being the extra hand for those members that just need a little bit of additional support or help understanding the whole CDAS or IHSS options. So members that may be struggling to navigate the hiring process, or those seeking to learn more about self-directed services, or just needing additional guidance on management skills are all going to be great candidates for INA. We can also help members find community resources, as well as stay within their budget of their services. So now I'll be going through the different service type options through INA. When members enroll, we help them kind of choose which service type is best for them and to support them. So the first one we'll talk about is Medicaid navigation. So Medicaid navigation services through INA provides education on Health First Colorado, long-term services and supports, and HCBS. It will explain and provide resources on the process to maintain an individual Health First Colorado case, assess other LTSS benefit needs, and will teach members how to work directly with the case manager. It can also help and explain applying for other benefits and will provide guidance on the benefits they are enrolled in. Consumer direction education with INA will teach members development skills on consumer direction principles, help members develop self-advocacy skills, and help determine and assess the members fit for CDAS or IHSS. So this is a really great service type for those members that are new to self-directed services and are trying to choose between whether they are wanting to go through the CDAS program and be their own boss or work alongside with an agency for that extra support. And we run through kind of both options with the member or AR to determine what's going to be the best fit for them. Support resource navigation. Will provide support in finding resources to gain assistance, learn about available support resources, types and benefits of CDAS employer-specific resources, as well as how to address an employer complaint. Service quality reporting will cover what quality services entails, how to improve service quality, help members decide and determine when service complaints should be made. We can also help file a complaint or grievance about an attendant, a case manager, case management agency, one of the FMS providers, so either PPL or PELCO, IHSS agencies, us here at CDCO, as well as the Department of Healthcare Policy and Finance. Member enrollment through INA services here at CDCO is a service type that can help provide support when completing enrollment paperwork for CDAS program, or help members find an IHSS agency that is a good fit. It can also help members choose between IHSS or CDAS programs. And we also support with members that are transitioning from FMS providers during that open enrollment period, as well as that FMS enrollment paperwork as well. Emergency backup planning will helps members develop emergency plans, attendant backup plans, attendant safety plans for CDAS. What can also help through the background checks and the exception process as well. So I've helped members that choose the service type create backup plans for emergency scenarios such as fire evacuations, or for when attendants are sick and need coverage. So it's a pretty broad service option, but just want to make sure our members have a plan in case emergency or an attendant is sick. Attendant recruitment and retention is probably our most chosen service option. So members who choose to gain extra guidance with attendant recruitment and retention will develop recruitment strategies, gain assistance with creating and posting advertisements for attendants, will help support with attendant interviews, can provide guidance on setting wages and scheduling caregivers, and help with terminations if need be. So, for example, members that are needing help creating job posts or cannot find caregivers or need additional hand-on support, screening potential attendants are all great candidates for INA. Mediation is the other last and final service option that we offer. And mediation with INA services will provide mediation for service authorization conflicts between the member, AR, and case manager, or an agency, and mediation for service delivery conflicts between the member, AR, and the attendant. So, for example, members that are having issues with an agency following care plans or not providing attendance when scheduled are prime examples of when members or ARs or case managers may request we complete a mediation. So now I will be going through the INA services referral form, and once I'm done presenting, I will drop the link to it into the chat, as well as my contact information for any follow-up questions, everything like that. But you can find our INA referral right on our website at Consumer Direct Care Colorado under the Information and Assistance tab. So here you will not only find the referral form itself, but we'll also find additional resources about INA INA services. The referral form will gather very basic contact information and will help you move along to the next steps and connect you with an INA coordinator. If a member needs help with the referral process, their case manager, FMS provider, or us here at CDCO will be able to walk them through this first step. Once we receive that referral, we process it within 1 business day and then get you set up with our INA coordinator that will be assigned to your case. And you'll do like an intake session. And during our intake session, we really just create a plan for how we can best support you moving forward. Yeah, so now this is my contact information, but if you have any questions, I'd be happy to answer if you drop them in the chat.
And I just dropped in I need to get in the habit of providing this at the beginning of every meeting, is a HCPF and Associated Services acronym decoder. Because sometimes it sounds like we talk in a different language. And so that's the one link that's in there. That's just for me, Carly. So any questions for Carly?
Thanks, Brooke, for dropping that in. I appreciate it.
Yeah, it's I use it quite often. Carly, how long have you guys been doing this? How long have you been offering this now?
Yeah, so we started November 1st. So just a couple months now. So it's still relatively new, but yeah, just trying to promote it in any way that we can. And we've definitely seen an influx with CFC coming up on July 1st of members kind of getting ready and preparing for some of those potential changes and everything. So yeah.
That was going to be my question too, is if you're seeing folks actually take advantage of it. It sounds like you are, which is great.
Yeah, definitely. We have one other coordinator right now, but we have a new one starting on the 30th. So our team is definitely growing and it's very exciting. So
Perfect. Thank you. It looks like Ashley has a question. I'm just going to read out so it's captured on the audio recording, but will this affect the allocation of those who are already on CDAS, and who will be the one to get the hours and allocation, a case manager or the nurse assessor? So that's a
yeah, I think that's more in regards to CFC. So INA is an optional program. But my understanding is the allocation will still be coming through that case manager with, I believe, the nurse assessor kind of guidance on approving those hours for that allocation. But that should still be completed on case manager side before it gets to us. So
thank you, Carly.
yeah.
Any other questions while we have her? All right. Well, I will let you drop your contact information and stuff in the chat, and then folks can follow up if things pop up or bubble up. But thank you so much. We're really excited to share this and connect folks to this resource.
Yeah, awesome. Thank you for the opportunity. I'll stop sharing my screen now.
Thanks. All right. And I'm going to let Carly drop that information in there while I get things pulled back up. All right, so we are running just a little ahead of schedule, which is fine because I know we have lots of open forum announcements for my team and hopefully other folks as well. So we're just going to go ahead and move into our next presentation. And I'm going to hand it over to Tiffany, please.
Good morning, everyone. I am so happy to be here. My name is Tiffany Damakos. I am in the Office of Community Living and working on the access rule as a federal policy advisor. You can go to the next slide. So I left this mission slide. I know we often kind of skip over this a little bit, but I think this is really important for us to highlight because part of what the access rule does is looking at equity, access to Medicaid, and the outcomes for the people that we serve And that plays right into our mission at Healthcare Policy and Financing. Next slide, please. Actually, you can go to 2 slides. Thank you. So we're going to start with a poll question. I'm curious if anyone here has, and we'll just use the chat, if you have heard of the Federal Access to Medicaid rule before today. So just a yes or no is totally fine in the chat. I see lots of yeses. Great. Okay. All right. So it sounds like mostly yeses, a couple of nos. So today I'm just going to give a really, really high level of the Federal Access to Medicaid rule. There are a lot of pieces. There are a lot of moving parts. I know we probably say that a lot, but it is very nuanced. And so Colorado as a state in response to this rule is still coming up with all of our solutions to coming into compliance. So please ask questions as we go. I will pause for questions at the end too, but know that it's kind of a work in progress right now. And so we might not have all of those answers, but we want to know kind of what's out in the community, what you're hearing about, and what we need to address as we come to community members. Next slide, please. And I will apologize, I have been sick this week, and so I will be sipping on tea as we go along, but yeah, we will make it through. So the Federal Access Rule came out in May 2024, and it gave states varying deadlines for compliance. So like I said, there are lots of parts that we're going to go over today, and every state is at a different sort of stage of compliance. So every state will have to go through different processes, and we're trying to share resources and ideas. So for example, Colorado already has a method for complaints. You probably know about it. If you don't, we will help you get connected to that resource. But there are some things that are already in place in Colorado, and then there are some things that we'll need to be working on. And we'll talk about that as we get to those slides. Next slide, please. So the goals for the access rule are to improve access to care, quality, and health outcomes for people accessing Medicaid. It's to address health equity issues and increase transparency and accountability for service providers, case management agencies, and anyone serving members accessing Medicaid. We are hoping to, this rule is hoping to standardize the data and the monitoring processes across the country. So right now, every state does pretty much everything a little bit differently. This rule will help us standardize, and so that when people move, there's similar monitorings, there's similar transparency, accountability, and similar engagement opportunities. Next slide, please. So these next 2 slides are our timeline. I know Brooke will give you these slides, access to these slides later. So I wanted to include these. I'm not going to go over them because you're probably not going to know all of the details of what they mean. So I'll address them in the rest of the presentation as we get to these items. So Brooke, let's go 2 slides here. So the first kind of big thing for us to be working on are advisory committees. So the rule requires an establishment and ongoing operation of public advisory committees. They're requiring these 3, which are the Medicaid Advisory Committee, the Benefits Advisory Committee, and the Interested Parties Advisory Group. Each of those committees will provide a different type of advisement for the department. Currently, we have things that have sort of met some of those requirements, so we're in the process of updating those and bringing them into compliance with the requirements for this rule. I'm going to drop in a link to our advisory committee page. We are currently accepting applications for the Medicaid Advisory Committee, which for Colorado, that will be named the Medical Care Advisory Committee, so MCAC. So if you see MCAC anywhere, that is our Medicaid Advisory Committee. And on this page, you will see contact information for our lead for the project. You'll also see some links at the top of the page for the application and more information about these committees and what they will be doing. You'll see on this slide that the Medical Care Advisory Committee will be giving input to improve and maintain quality programs. The Benefits Committee will be our Member Experience Advisory Council alumni group, will be being used as the liaison between the groups that are currently running. And then we're working on the Interested Parties Advisory Group that will advise on rates for certain services. Colorado already has an advisory committee for that. They just meet at different times and they have different membership requirements. And so that's why Colorado will need to update those requirements. And so perhaps we'll be developing a new group, or like I said, kind of modifying the groups that already exist. Next slide, please. So we wanted to come to this group because we know that you all have been on this committee for a while now, most of you, and we're curious what your experience with advisory committees with HCPF has been. Has it been positive, negative, neutral? Have you maybe not been a part of an advisory committee at all, or don't want to anymore? As we're developing these groups, we're trying to figure out what works, what doesn't work, what are some things that we can learn from previous experiences. So if you're willing to put in the chat kind of what your experience has been. In the next slide, there's a couple of other questions. What are some things, if it was positive, what worked well for you? What didn't work well? And what do you want to see as we're developing these committees? I'll pause and stop talking so that you can like think and write. But I just wanted to put that out there. And if you don't have an immediate answer, that's okay. You can email me directly afterwards, or Brooke. We're happy to take more feedback back to the team. This is one of our first outings into the community about the access rule. And so, yeah, like I said, we just wanted to get some feedback about what's worked, what has not worked, if there's anything that we should be paying attention to as we come into developing these committees. While you're writing, this committee will be started in July of 2025. So that those deadlines are coming up soon. If you are interested in applying, you're welcome to do that. We're taking applications right now and would love as much participation as we can get.
I will just say, just as you're welcome to type in the chat as well, but I know that some folks are using accessibility devices too, and sometimes typing can be like a whole thing. So if you are comfortable coming off mute, we will, I don't want to speak for Tiffany, but I would welcome that as well, just for discussion.
Yeah. Sure.
We actually lost a couple people. Well, I said that, so maybe I scared folks. I don't know. But I am just going to read Ashley's experience out just to capture on the recording, or Tiffany, if you'd like to, that would be great as well. All right. So first of all, Todd says he's had a positive experience so far with advisory groups. But Ashley says the best people to be on these committees are those real life experiences who are going through Medicaid changes and the healthcare changes, as I'm guessing CFC comes online in July. If any of those have problems, they would be able to bring that to the committee and solve it, and it affects many more.
Yeah. That's great. I think we are in agreement with that. And those are some of the requirements for those committees is people with lived experiences and providers. So thank you for that.
And Joseph asks, what role are you looking for long-term care providers to play in these groups? It's a great question.
Yeah, that is a great question. So each, like I said, each advisory group will have a different role. And so if you were chosen for a specific committee, then that committee you would have a role in fulfilling that committee's requirements. If you have more detailed questions, you can email me or Sarah Davis is the lead for the first two committees, and that will be launched in July, and she can answer more questions too. And that's on that website that I just chatted in. So yeah, I mean, I think taking an active role, I think we're looking for applicants who are able to commit to that group. I think there are specific timeframes that they're looking at for each group. But Sarah would be able to answer those questions. I can also take that question back and let you know, Brooke, and you can bring it back to the group.
Yeah, I think that would be great. That might just be nice level setting for folks just across the board. Yeah.
Yeah. I will say those application deadlines are coming up pretty soon though. So even if you're a little bit interested, go ahead and fill it out or ask some questions directly so that you don't miss that deadline if you're interested. All right, we will keep moving.
Tiffany,
then.
sorry,
Go ahead.
can I just, sorry, just to clarify on the question, I was just wondering where you think providers would be sort of best positioned among these three committees.
Gotcha, I understand.
Just trying to give a little bit of direction to our members who are involved in this space and are caring for Medicaid members. Think it would be really valuable to just know a little bit of where HCPF sort of foresees them being best positioned to be contributors and also giving space for the voices of people that are actually members or used to be members to be able to share their perspective, which is, of course, so valuable in these discussions.
Yes. So currently we have a member experience advisory council that is composed of members. And then from there, they will move, there will be an opportunity to move to an alumni council. So I would say if you're coming in as a provider, the medical care advisory committee is probably the best place to start. It will be a little more high level. That group will be looking at improving those quality outcomes. It will be a place to talk and discuss about problems that you're seeing in the community, in addition to reviewing some of the reports and quality measures that we will be doing through the access rule. Does that answer your question?
Yeah, thank you. I appreciate just specifying will make my job a little bit easier.
Yeah. And then I saw Ashley's question about the application. So there is a link on that page. I'm just going to drop the link in here for you. It goes to a Google Doc. And then that Google Doc also has a link back to the web page if you need more information. So either of those should work for you. Yeah, and we'd love to have more applicants. So that would be great. Any other questions? These are great questions. Thank you so much. All right, Brooke, we'll keep moving then. Oh, deadline date. I don't know it off the top of my head. I'm not seeing it.
Tiffany, I know we have a handful of HCPF folks on here. Perhaps somebody could do a little research for us and drop that in the chat. Let me put
Yeah,
folks on the spot, huh?
I know. I know. Maybe Sarah, do you mind chatting Sarah Davis and see if we can get a deadline by the end of my presentation?
Perfect.
Okay, we'll
Thanks.
start it. All right. So another piece of the rule, the access rule, is a requirement for each state to have a grievance or complaint process. It will focus on reporting complaints about person-centered planning. I apologize for the acronym on here. PCP is person-centered planning. And it will help to streamline our definitions across programs and streamlining our internal processes for that resolution. So for Colorado, we have a grievance process, but we have a couple of different ones. We have an escalation process, we have a grievance process, we have a complaint process. And so that's part of what we're working on, is pulling all of those together, and then what we'll need to report to CMS is to the federal government is that those specific pieces about person-centered planning and the home and community-based services settings issues that are coming out of those complaints. The access rule also creates requirements for individuals' accessibility, including language, readability, and other obstacles. So like I said, this is still a work in process. We are working on making those updates and to come into compliance with this in July 2026. The other piece that kind of goes hand in hand with those grievances is the critical incident reports. So the access rule requires that the states report on the operation and maintenance of a critical incident management system. And the system has to identify, report, triage, investigate, resolve, track, and trend all of the critical incidents for members in home and community-based services. They have to be reported on certain timelines, and we have to use specific federal guidelines. The critical incident system doesn't have to be in place until 2029. We do need to start reporting in July 2027. So HCPF is working with our internal teams. We already have a critical incident reporting system with the case management systems that are used. What we're working on is figuring out that reporting process to track and trend. So we have the tracking, we need the reporting to be able to trend and send those reports to CMS. Again, another process, another thing for us to be working on in the background. Next slide, please. Another piece of the rule is about provider payments, and this might most interest you all. I know this is part of what has been presented previously. So one of the concerns of the access rule is that there be sufficient providers in any given area or state. And one way to look at that is provider payments. So there are a couple of different parts to this. One is provider transparency, and the other is the direct care workforce provider payments. So states must ensure that provider payments are transparent, that they are available to the public. HCPF has most of our provider payments available. There's some nuance in the rule about pulling apart kind of bundled payments. And so that's part of what we're working on with our rates team and other teams at HCPF. And then the other part is that direct care work payments must be 80% of the Medicaid rate for certain services. And these are services that are typically kind of difficult to maintain over a long period of time. There might be a lot of turnover. So for transparency, we have to be in compliance by July 2026. For the reporting, we will start in 2028. And then that 80% piece, we don't need to be in compliance until 2030. With that said, we are already working on those pieces. I know that part of this group's work has been kind of addressing direct care workforce payments and the development of the direct care workforce. So this is Colorado is well above and beyond where many other states are, but we still have some work to do. So if you have questions about this or the reporting process, feel free to put them in the chat or come off mute. Like I said, this is a really nuanced process, and discussion in Colorado is we're still working it out, how we'll be coming into compliance with all of the pieces of the rule. So if I can't answer your question and no one here can answer your question, we'll take it back to the team that's working on this and make sure we get those to you as soon as possible. So I'll pause for a second for questions about this or anything else we've talked about.
I do just want to point out that Sarah got the deadline in there for us. So interested individuals may apply online application between May 12th and July 1st. So July 1st is going to be that deadline for you. So thanks, Sarah. Thanks, Tiffany.
Yeah, thanks, Sarah.
Tiffany, this is Cindy. Can I ask a question?
Yeah, of course.
So in looking at, I know this is not necessarily HCPF's rule, right? But looking at the direct care payments for providers must be 80%. How has there been any talk about what happens when provider agencies aren't able to do that? Because the cost to employ, to monitor, to pay licensing fees, agencies aren't going to be able to pay 80%. How is that going to be addressed?
Yeah, I think that's a great question. And like I said, there's a lot of nuance. So it does include compensation includes wages, salary, training, benefits. There's a whole bundle of things that it includes. So it's not just the hourly salary has to be 80%. It is that whole bundle of compensation. Even I think tuition reimbursement is included in that package. And it's only for what we have to report on is only for home health aide, personal care, and homemaker. So that's part of what we're working out and trying to figure out. There is a possibility. There are some exceptions. There are some exclusions to that process. So yeah, I think, Cindy, your point is well taken that it's costly, right, to run a business. It's costly to employ people. And the goal of the rule is not to put businesses providers out of business, right? It's to make sure that we're keeping workers there. So I think that we'll find some balance, and that we'll be working closely with agencies to figure that out.
Okay, thank you.
Yeah, great question. Thank you. Other questions? All right. Well, we will keep moving then. So the next section is the quality measures. So starting in July 2028, we're required to report on mandatory quality measures in the home and community-based services quality measures set. We'll have state-established performance targets and specific quality improvement strategies. So states who are money follows the person grantees, which that is Colorado, we will start that in the fall of 2026. And this is a primarily reporting piece of the rule. So it is not there's not a lot of specific work to be done, except that we'll be pulling measures. So some of those measures might be, does a person choose their services? Are service plans updated and revised annually? Do service plans address an identified need? Our service plans delivered in accordance with the service plan. So it is, we're still figuring those out. Again, this doesn't start until 2028. We'll have some pieces for Money Follows the Person in 2026, but more to come on this one. Next slide, please.
Sure. And while we have just a quick break, I do want to just, Kim's comment, she just echoes what Cindy said, that agencies will need to see the list of what is included in the 80%. So just having clarification on that. So thank you, Kim, for just kind of echoing Cindy's sentiment as well.
I was going to do this at the end, but I'll go ahead and put in the link to the Federal Register so that you all can see it's public. You can see what's in the actual rule that we are the ones looking at, and working with CMS on that interpretation and application to Colorado specifically. So person-centered plans, we already talked about these a little bit, but we'll be reporting to CMS on the person-centered planning process. Things that we'll be reporting on, like that it has to be done annually, has to include the member who is receiving the services, and must be done, the person-centered plan must be done with a change in circumstances or need. This starts in July of 2027. And again, these are currently requirements for Colorado. And so this will be a report that we are providing, and then we'll get feedback on that. All right, next slide. Website transparency is a piece of the rule that requires that we have a centralized website that has plain language and reports on the access rule reports that they have to be posted on that website. There are, again, certain requirements for accessibility. This is a piece that Colorado is ahead on. We do have a very robust website that has very robust information about what goes on, where you can get contact information. So we'll be creating a page that is just for the access rule. You'll have more information about each of these pieces. And as they're developed, we'll be updating those pieces of that website with what Colorado is doing, how you can get involved, who the contact person is, those kinds of things. But for this rule and for compliance with CMS, this reporting will start in July of 2027. So we have some updating to do, and we'll be working on that over the next couple of years. Next slide, please. So the last piece is the wait lists and timeliness. So starting in July 2027, states have to report to CMS on the number of people on a wait list for home and community-based services. And it has to include how the list is maintained and how long people wait on the list before receiving services. We will also have to report annually on the timeliness of access. So for these specific services, CMS wants to know how long it takes from the point of entry into the system until the first day of service that it takes for a person on an aggregate level across the state of Colorado to access these services. Again, we're looking at quality of care. We're looking at how quickly someone expresses a need, accesses the system, and then is able to receive those services for those needs. I think that's it for this one for now. So yeah, we will pause for questions, and I am happy to phone a friend again if I can't answer your question.
And just in like some conversations that we've had with Tiffany and this team as well, like this isn't a one and done for us. This was just kind of like a general overview, and we'll kind of continue to bring information back as it unfolds. And so I guess what might be helpful is for Tiffany and team to just kind of know what information would be helpful for future updates or overview or things like that too. And again, we don't know what we don't know, and so you may not even have ideas, but just know that you'll be seeing them. Again, this isn't just a one and done for us. So there's a question from Elizabeth. Have you considered using the DCW, the Direct Care Worker Stabilization Board, as the IPAG?
I don't think I know what the stabilization board is. Do you?
I think just really general. It was created last year out of legislation. It has representatives from workers themselves, advocacy orgs, and state agencies, as well as providers and employers. They just did like a recommendations report. So
Okay.
yeah.
Yeah, that's something that I can take back to the team. That is, the IPAG is something that we are still kind of figuring out. We have some irons in the fire, and it does require a lot of people to kind of sign off on. So yeah, happy to take that back to the team, and we'll definitely take that under consideration. Thanks, Elizabeth.
Thanks, Tiffany.
There are so many committees that it's hard for everyone to keep up. Clearly, I did not do my homework and know this one, so thanks for bringing it up.
We actually have an announcement in open forum about the next Direct Care Worker Stabilization Board meeting. So we'll share that with folks too, just to do our best to try and keep up with all the happenings.
All the things, yes. Okay. Well, Brooke, you want to share our contact information? So again, my name is Tiffany. My supervisor is Sarah Hurley. We are a team working on all of this compliance together. So we put our waiver inbox here for contact information in case one or both of us is out of the office. You can reach someone on our team to get answers to your questions. I can put that in the chat too, if that's helpful. But feel free to reach out if you have questions or anything that comes up about the access rule. We're happy to answer. Thanks so much for having us today, Brooke.
Yes, thank you, Tiffany. We appreciate the information, and we look forward to just kind of keeping tabs as we roll out.
Yeah, sounds good. Thanks.
All right. And again, you'll have contact information, links, all that good stuff will go out with the slides. So we'll make sure as questions pop up, we are connected to the right folks. All right, so as we kind of move into our last 15 minutes of today's meeting, we do like to move into our open forum, but just while I have you, before I lose you, if you have to drop off a little early, we would love to hear your feedback on our survey. I'm gonna get the link for you here. This just keeps us in line, make sure that we're providing information that is helpful for you and information that makes it worth your time to come to these meetings. Just feedback, you can rate us, it's anonymous, you can be as kind or as critical as you like. We do take the feedback. That's why we have an open forum. We didn't have one until this survey, and somebody said, hey, we'd like a little time to share. So here we are in this open forum. So if you have just 60 seconds to fill that out for me, I would be greatly appreciative. But yeah, we're going to just take some time for open forum and announcements. I know I have a couple things. I know my team has a couple things, but we'll just give folks the floor and let stakeholders kind of take the lead and go first for us if there's anyone that has anything. This is a great place to share resources, trainings, websites. If you have something exciting coming up in your agency or great ideas, questions for other providers. And if there is none, I'm just going to share this really quickly. Clelia McVeigh, that's typically at these meetings, she wasn't able to join us today, but she's been a great supporter of this group. And they are having a job fair for the city and county of Broomfield. It's multi-industry networking and career fair. And so it's just resources. You could have a resource table. You don't have to be an employer. She has the QR code there for us, but I'm also going to drop a link in the chat for you to sign up. This is for employers who might be interested in having a table, but also for folks who are interested in attending. So both of those are around on that through the QR code and through the link. And so, yeah, if you're in that area and you're looking to connect or looking to get a job, there's that for you. It starts at 2 o'clock, but I do want to note that they do have veteran priority. So they do access or allow veterans to access 15 minutes early to get in and connect with folks before opening to the general public at 2 o'clock. And then we do have the Direct Care Workforce Stabilization Board meeting that we were just chatting about a little bit. Their next meeting is July 11th. I know they had a bill go through that was implementing some recommendations. And so that meeting would probably give you a little bit more information about those recommendations and what they're looking to do. I'm not sure if we have anybody.
Yeah. Brooke, I'm here.
Oh, Carrie. Hey, Carrie.
Yeah, hey. Yeah, so it is July 11th. It's our usual time, 12 to 2. It was House Bill, I think it was House Bill 251328 that recently went through. And they put in a bunch of recommendations, so they'll probably be discussing that at the next meeting. So
perfect. And it looks like Heather dropped the link into the chat for that, for the bill language. So you can take a peek at that and then come to the meeting and hear all about it. And then the last thing I have, and then I promise I'm going to stop. We know that it's a bit of a information overload right now with state and federal changes to Medicaid and information around that. And so HCPF does have a website for just understanding the impact of potential federal funding cuts or changes. And so we do have this website that's continually updated with updates from our director, and then kind of as language and stuff moves through federal legislation and all that stuff, continue to update that. So maybe just bookmark that just to kind of keep a tabs on how that will impact Colorado specifically. And then if there's anything that's happening in Colorado as well, state updates will be posted there as well. So it's just it's a good resource if you're trying to keep tabs on just information overload at this point. Heather, please.
I'm just going to drop the link for the Direct Care Workforce base page in, along with a reminder that base wage compliance starts July 1st. So even though there is not an increase in the direct care worker base wage this year, outside of the Denver minimum wage, which was raised to $18.81 in January, we will continue to do base wage compliance checking. So everyone this year will get a link to their email. There was a memo that went out asking everyone to make sure that their information is up to date in the provider portal, because that's where we're going to send that link. And that is operational memo 25029. We're also running it in the provider bulletin. We'll have another few memos going out and some more OCL newsletter and bulletin memos. Similar to last year, we are collecting information about benefits. And if you all were here at the start of the presentation where Rachel gave a lot of those survey results from the State of the Workforce Survey, we are essentially kind of taking over that and looping it into our base wage reporting because we ask a lot of the same stuff. And as you noticed from her reporting, the way NCI does it, they don't include independent contractors. And we know that that does exclude about 6,000 or 7,000 of our workers. So just putting that on everyone's radar. You will get a link. If you don't get a link, don't worry. We'll have some information. You can we'll get you the login password for that. And reporting is open for 2 months. So all of July, all of August. And yeah, if you have any questions, you can read about the FAQ on our website. Our email is on there for the base wage team. Feel feel free to shoot us if you have suggestions. Just let us know. We're happy to see what we can do to make the process smoother. We know it is cumbersome, but it also is super important to make sure that workers are being paid what they're supposed to. And I will say from our last year's review of providers that were not doing it right, we're really good about saying, understanding, oh, okay, this is how we need to do it. This is how we need to report things differently. And so we really want to be as helpful as possible with folks. Also on the website, we just added a little bit more about the compliance aspect. My team doesn't do the compliance, but we work with our compliance folks on that. So you can see some information about that. So thank you very much.
Heather, can I
go
ask
ahead.
a question?
Yeah.
So I get we have to report this year, right? Because of the bump. But moving forward, are you going, so it is now like it's right, the law, you have to pay a certain thing. Are you going to continue compliance tracking after this year?
Yes, we will continue to do it. Considering the turnover in the state, we would hope that we would have base wage increases, right? So always hope that we have increases, so that is good. But and the other issue is because we do have a lot of turnover, we have to be able to demonstrate that compliance. So it will continue. In the
If you
foreseeable
could take
future
back
anyway.
this is an administrative burden, and the more now if you're going to start asking about benefits, I don't know if you guys realize how much this takes. And with the, yeah, I get there was a rate increase this year. We've been told very clearly there will not be, and you keep putting more and more on providers' plates. So this is my concern with this. I don't, right? It's going to be the law, so anybody can report you, and right, you're going to have to show proof. But the documents you are asking for is really becoming burdensome. So I would just ask that you reconsider moving forward.
It aligns with the access rule as well and what we're working for with that. So we do want to find the best balance between
if providers continue to provide those services. But if you don't continue to provide those services, so is it just going to be for those services or for all services?
That isn't fleshed out yet. So right now, base wage within the regs, it's all the primary services that are related.
Okay.
And so we would love to make it more. It's me and one person doing 1,000 reviews as well, right? So I understand, like, it is a lot. It's a lot of what is being asked, and we just ask for folks to help us find ways that make it work easier for folks. We definitely have some bigger provider agencies that make it, if you have 10 employees, it's a little easier to report on that. When you are reporting for 1,000 employees, it gets way more cumbersome. So we welcome the feedback. If you have some suggestions, shoot us an email. We really want to kind of work on that for folks.
Okay, thank
I
you.
just don't imagine it's going away though. Thank you, Cindy.
Mm-hmm.
I was also going to chime in about the direct care career site. We have over 850 individual users signed up. We get about 100 new individual users a month, which is really good. Taking a lot of trainings. We are getting a new LMS, the learning management system. What that's on the site is going to be changing in July. So it'll look a little bit different, same content, just a little different. So be on the lookout for that. If you haven't signed up for the site, please do. We do control who signs up as a provider, as an employer. Those are open to our PACE, our HCBS, our PACE, and our long-term home health providers. As an individual user, those are open to all direct care workers, prospective direct care workers, and even natural providers, natural supports who are providing that care for their individuals. Lots of trainings, resources, videos on there. So just wanted to put a shout out to folks to check it out. Thank you, Brooke.
Thank you, Heather. Any other comments, questions, things to share, comments about anything that's been shared? We're not kidding when we say it's like information dissemination. We're just spitting it out at you the whole hour and a half. So all right. Well, I'm keeping note of the time. Looks like we're down to our last 5 minutes. So I went ahead and shared the job fair. We do want to share a topic request form that we have. We work with our leadership team to kind of come up with topics. If any topic request form comes in from a stakeholder, we send that out to the leadership team to kind of vet it, make sure it fits our standards, and then make sure, not standards, make sure it fits our topics that we like to stick with. And then we work on trying to get presenters in for that. So I'm going to share the topic request form. Anybody can use that. It is for suggesting a topic, but also if you're a presenter and you have information you'd like to share back with this group, we welcome folks to fill that out as well as a presenter, because we'd love to hear from folks if you have good things happening, things you think might help the group, providers, workers, all that good stuff. So I'm going to share the topic request form, and my survey link somehow just snuck in there as well. If you have just a few minutes to complete the feedback survey, we would really, really appreciate it. I'm not sure how that got in there. That's so weird. Our next collaborative meeting will be Wednesday, September 10th. So 3 months from now, same time, 10 to 11:30. We are building out the agenda for that. So if you have a topic you'd like to see come up in September, we'd love to hear from you. And that gives us plenty of time as a leadership team to go ahead and get presenters lined up for that. Put that on your calendar if it's not already. Survey again, please and thank you. That wraps it up for us. Any parting thoughts from attendees, co-chairs, anything before we let you all go and enjoy the rest of your day? All right, well, awesome. We look forward to seeing you in September, not only for the collaborative, but for picking back up for the action groups. Let us know if you have any questions in the meantime. Thanks so much, everyone. Have a good day.